So again, you're going to see kind of a pattern in how these use disorder criteria are structured across the drug classes. So what we're going to see here, again, similar to alcohol, use disorder criteria are 11 aspects of the primary criteria under A, and similar to alcohol, the criteria is going to be based on two or at least two of the following within a 12-month period. And from there, we're going to see a lot of similarities, larger amounts over a longer period than was originally intending to use less than before that use, than what actually ends up being used in terms of duration and amounts. Persistent, unsuccessful efforts to cut down or control, increasing amount of time spent on obtaining, using, and recovering. Cravings, either physiological or strong psychological or habit forming, habitual behavioral urge to use cannabis. Okay, so pause there and go on to the next slide. Okay, continuing on with criteria A, we're going to see again a lot of the same similarities across all the drug classes. A failure and then often a kind of increasing intensity of failure to fulfill major role obligations, whatever they may be. Continued use despite social interpersonal problems, in increasingly withdrawal from social, occupational, recreational activities, especially those that don't directly involve the substance use. So a person may be spending less time at work or even less time with, let's say, outdoor recreational activities, and focusing more and more on a activity like video gaming, where at least for that individual, it's a place where they use the cannabis, and they use it in a socially, in a realm that's socially acceptable. So the individual will begin to just focus more and more on those activities where the cannabis is used is socially acceptable, and maybe socially expected in some circumstances. And just like all the other drugs classes, increasing situations where it can be where there is physical safety hazards either in obtaining or using the drug. So the authors tell us that based on their review of literature, that there absolutely is a phenomenon of tolerance and withdrawal associated with marijuana use. So and those become the 9 and 10 of cannabis use disorder criteria. So here we're going to see the same remission criteria for early and sustained, as well as same criteria for sobriety in a controlled environment. So under diagnostic features here, we have a very handy list of typical observable phenomenon associated with withdrawal from cannabis. I will, and I added this here and actually kind of made it separate just to underscore it. There's no question that when we look at severity of withdrawal in terms of the first-person experience of withdrawal, as well as level of medical care needed to monitor that withdrawal and detoxification process, it is generally not as severe in terms of the first-person experience, as well as the need for the level of acute need for acute medical intervention. But that said, these, and I've seen this in my clinical work, absolutely, these can be very severe and they can impact the person greatly. And while that experience may not be as severe as someone withdrawing from alcohol or a benzodiazepine, acetaminophen as an example, it is pronounced, and they will feel it, and it will impact them a lot of times in a very significant way. Okay, a few data points here. The authors themselves pointed out that that the perception that cannabis is less harmful than other drugs like alcohol or even tobacco can be a risk factor in people using more and having a higher risk of developing a use disorder through the vehicle of occasional and recreational use. The other thing that they noted is that among adolescent users, you'll see mood instability, you'll see a hit to their energy level and motivation, as you would in adults, but they make the point that this is particularly pronounced in adolescence, and you'll see a change in eating patterns, and that can be either direction. You can see uh, folks, adolescents, eating less and actually losing weight. You can see many others who can sometimes rapidly develop a significant obesity problem within the context of the cannabis use. So um, there's lots of social risk factors, particularly among adolescents, when we talk about cannabis use. So you see some of the psychosocial, common psychosocial consequences of cannabis use and cannabis use disorder. Another thing in terms of physiological effects, heavy cannabis users tend to have, particularly as they age, have much more frequency of respiratory illness and severe respiratory illness, like COPD and emphysema and asthma. Certainly at higher risk, just as tobacco smokers are, for developing lung cancer and other respiratory cancers. Bronchitis, sputum production, overproduction, shortness of breath, and wheezing are all byproducts of heavy marijuana use. And and of course, the book is kind of, is a little bit aged to really get into this. But I would tell you, and you can, you research this on your own if you're so inclined, that vaping versus smoking is not necessarily going to minimize your risk or a person's risk of respiratory and sometimes severe respiratory problems, particularly over a long period of time and as people age. All right, so here's the criteria for cannabis intoxication, 2 or more. This is a handy kind of short list of things that you will commonly that are observable and obviously experienced by a person within cannabis intoxication. Conjunctival injection, by the way, is just a fancy way of saying red eyes. But other than that, this is a good list and can be very helpful, in terms of having that list. If you're concerned that you have a client who's coming to your sessions under the influence or intoxicated from cannabis. Okay, we touched on this already in the diagnostic features section, but here is our list of signs and symptoms of cannabis withdrawal. The criteria reads 3 or more within 1 week after eliminating or significantly slowing down or decreased use of the cannabis. And like I said, in most instances, a vast majority of instances, these are not life-threatening or even necessarily needing of acute medical care, but they are very real and they are very noticeable and can be very vividly experienced by the individual.